Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, you are in for a real treat because backed by popular demand is one of our favorite plant-based cardiologists, Dr. Andrew Freeman. Every year he updates a wonderful talk called The Year in Plants, and this being 2024, this is his talk, The Year in Plants 2024. If you attend the Plantrition Conference this year, you'll get to meet him in person. He's awesome, and he's plant-based, and please welcome him to the show. How are you, Dr. Freeman?
Great. As always, it's so nice to be here and be amongst friends and like-minded individuals. It's always a plus.
Nice. Well, you're a real doctor. I mean, they're all real doctors, but I mean, you really see patients.
I see a lot of patients. At some point, I hope to figure out a better strategy, but for right now, that's what I do to make a living.
Well, yeah, because, could you just do this virtually? Probably not completely.
Yeah, I have some colleagues that do virtual consultations and so forth. It's a little bit of a harder gig in the current era, but it will get better and better. And telehealth is definitely here to stay. So
That's great. Well, how do you construct the talk, and how many years have you been doing the urine plants?
it's got to be at least 10. What I really do is I keep an email folder of any news, headline, article, whatever comes my way. And then usually in the fall of each year, I start putting together my talk on the last year's worth of collections. And then when I hit a 80 or 90 slides, I usually say, okay, that's probably enough. And then do it all over again year after year. And it's just mind blowing how much data and science is out there. It's really hard to keep afloat. But my goal with this talk is to help people keep afloat in a more sort of Cliff Notes, concise way.
Do you ever give it like locally, like at your hospital, for example?
Yeah, I have. And actually, we have a Veg Fest in Colorado that'll be coming up where I plan on giving a talk just like this as well, because there is quite a bit of interest out there for people to learn about what all the science and what's available out there. So, yes.
Well, I don't keep up with it the way you guys do, but there's one thing that has been coming up a lot, and I'm hoping it's in your presentation, that study about how a time-restricted eating is linked to a 91% higher risk of cardiovascular death. A lot of the plant-based doctors said it's because the people that were doing it weren't healthy to begin with.
Well, actually, that's not in this year's talk because I always capture the year prior, but it'll probably be my next one. But what I would tell you is, in general, that was a very poorly done study, and I wouldn't make any conclusions from it.
Thank you. None of the plant-based doctors are giving it any credence, but I look forward to next year's talk,
Yeah.
2025.
Plant-based or not, just anyone who is an objective, data, science-driven person will probably not give it much credence. So
Thank you so much for saying that. Well, if you're ready to throw your slides up, I can't wait to see it.
yes, so let me get that going for you. Hang on. Hold on,
It's okay.
wants me to do something different. Here we go. Okay.
Uh-oh.
And share screen. Here we go. All right. Can you see them?
Perfectly.
All right. So every year, for those of you that have not seen me do this, I try to put together a talk of all the latest science so that you can get really excited about making these changes for your everyday living. My disclosures, and then of course there are many well-done randomized trials showing efficacy improving health outcomes, but there are some studies that are observational without actual cause, but do show significant relationships. And before I get too far into this, everybody says and asks me the same question year after year. Well, it's great that you want me to do this. Where am I going to get my protein? And the answer is, of course, the same way all the animals do, which is from leaves. And it turns out that pound for pound, spinach, kale, broccoli, etc., have more protein than a piece of meat. But remember, a piece of steak looks like this, and a pile of kale or broccoli is a big, big pile. So eat your greens. So I always like to start off with some stats. This was in Reuters. So lots of the mainstream world is starting to pay attention to human health, not only because of its economics, but also because the entire world depends on human health in so many ways. And so more than half of the world will be overweight or obese by 2035. And the World Obesity Federation's atlas predicts that 51% of the world, or more than 4 billion, will be obese or overweight within the next 12 years. And the report found that childhood obesity could more than double, and the cost to society is significant as a result of the health conditions linked to being overweight, more than $4 trillion by 2035, or 3% of the global gross domestic product. So pretty eye-opening stats. And it turns out that despite all of these stats being published, more than half of US adults don't know that heart disease is the leading cause of death despite a 100-year reign. In fact, Joe Wu, a volunteer president of the AHA, said that heart disease has been the leading cause of death in this country since 1921. So surprisingly, people don't know this. So if you didn't know this, now you do, but kind of mind-blowing that people don't know the number one killer remains heart disease. And then if you look, lots of great data has come out over the last year, and I'm going to take us through some of the highlights. But this was a nice study out of the Nurses Health Study, which has been studied extensively, as well as the Health Professionals Follow-Up Study. 36 years of follow-up, 75,000 women, 44,000 men. They compared their diets, and those who were in the highest quintile of healthy eating index, which is a measure of how well we eat, had nearly 20%. The people who ate worse, had 20% more mortality. So you can imagine that magnitudes of outcomes are tremendous in this space, much more than any medication. So if you eat poorly, chances are you probably will end up dying sooner. And of course, I always talk about legumes. As you may know, stats are always published about this, but most of the world outside of the United States eats legumes, but we don't for whatever reason, but they really are a superfood. And in this study, of 32 groups of people with 1 million plus participants, if you looked at the highest versus lowest intakes, those who had more legumes in their diet had less death and less stroke. And for every 50 grams per day of legume intake, you had a 6% reduction in the risk of all-cause mortality. So you can imagine that if you ate a couple hundred grams more per day, you might do significantly better. And then another study came out from the same group, phytoestrogens, following about 200,000 men and women for 34 years. And if you eat more, you had less cardiovascular deaths, less cancer death, and the non-cardiovascular, non-cancer deaths were also less by a significant amount. And remember that phytoestrogens come from things like soy, but many other brightly colored fruits, vegetables, squashes, starches, etc. And then interestingly, the UK is also not any different in many ways than the US. And they're showing that there are significant increases in ill health and economic inactivity because of long-term sickness. More working people are self-reporting long-term health conditions, 36% saying they had at least one. The number of people economically inactive because of long-term sickness has risen to over 2.5 million people. Nearly 2/5 have more health conditions. Over 1 million are inactive because of long-term sickness. And you can see that the stats they're reporting look strikingly just like ours. And it turns out that it's costing them 150 billion pounds per year. And this is significant in terms of their income taxes and so forth. And the National Health Service in the UK was forced to clear up the dirt as obesity soars. And unless the ministers abandon their reluctance to encourage people to live healthier lives, the health service risks becoming unaffordable. So imagine that there is reluctance amongst the health ministers in the country to improve lifestyle. Kind of a mind-blowing thing to me. And it really does start with kids. So this is some interesting stats that came out of the 2021 National Survey of Children's Health. And of course, it always takes some years to get the data collated and published. But 32% of children ages 1 to 5 did not eat a single fruit each day. 49% did not consume a single vegetable daily. And 57% had at least a sugar-sweetened drink at least once a week. So we really need to do better. And you've probably seen that even in many parts of our country where there are economic disadvantages, food stamps go to cover sugar-sweetened beverages quite often, sadly. And then this was an interesting study of 204 participants in a diabetic cohort, and they were found that those who had more alpha carotene actually had significant improvements in their cholesterol, and subjects with atherosclerosis presented significantly lower plasma concentrations of total carotene compared with the subjects without atherosclerosis. So what this basically means is that if you have alpha carotene in your blood, which comes from things like carrots, you were much less likely to have coronary issues or atherosclerosis, whereas if you had low levels, you had more atherosclerosis. And so at the end of this, the authors say here that there's a potential atheroprotective effect of carotenes that might be synergistic and not given by a single chemical species, as we previously observed with lycopenes, which come out of things like tomatoes and watermelon. Now, there's been a lot of data over the last couple of years about pregnancy in the diet. And in this interesting cohort of about 1,200 high-risk pregnant women, they randomized at about 19 weeks gestation to a Mediterranean diet or mindfulness-based stress reduction program or usual care. And those who were in the Mediterranean diet group had significantly lower perceived stress, believe it or not. So there are benefits beyond maybe just even physical, but also mental. And then another interesting study, it looked at 76,000 mother-infant pairs, and they were using data from Japan. And it looked at the lowest compared to the highest intake group of total dietary fiber. And it turns out that when you ate more fiber, or if you ate less fiber, I should say, you had 51% higher risk of delayed communication, 45% worse fine motor skills, 46% worse problem-solving skills, and 30% worse personal social skills. So what we eat may have an impact on our child's development, which is pretty eye-opening. And then another interesting study, and this has come out lots of times over the years, but it turns out that for every 100 milligrams per day of added cholesterol, the risk for diabetes goes up by 5%. And compared high to lowest intakes, risk goes up by 15%. Western countries, of course, were worse. And avoiding animal products, which are the only dietary source of cholesterol, is truly best for diabetes prevention. You've probably seen me in years past talk about eggs. And it turns out the more eggs you eat, the more diabetes you're likely to have. And so eggs are a very potent source of cholesterol. More and more data is coming out about low carbohydrate and keto diets. This was a diet of 305 people eating a low carbohydrate, high fat diet versus 1,200 people eating a standard diet, followed in the UK Biobank for over 10 years. In this case, almost 12 years of follow-up. And after adjusting for risk factors like heart disease, diabetes, high blood pressure, smoking, et cetera, people on a low carbohydrate, high fat diet had 2 times the risk of major cardiovascular events, higher levels of cholesterol and ApoB, another type of cholesterol as well. And then you've probably seen me mention this again, but more data continues to reinforce that men who closely followed a plant-based diet lower the risk for disease progression and recurrence of cancer by 52 and 53%. Men over 65 had a benefit too, particularly when combined with exercise. So again, one of the best ways to reduce your risk for a lot of cancers is to change your diet. How about in kidneys? So it turns out that more and more data over the last couple of years has finally shown that a plant-based diet is really quite beneficial for kidney disease. This was a new meta-analysis of 4 randomized controlled trials. And the conclusions were that a vegetarian diet improves how well your kidneys filter, even in patients with chronic kidney disease. This is another 117,000 person study, and they followed them for about 10 years. And they looked in general, and those who had the highest quartiles of plant protein intake had 18% less chronic kidney disease. And so in this large prospective cohort study, greater dietary plant protein was associated with a lower risk of incident chronic kidney disease. Another interesting study, calcium supplements in the UK Biobank, not quite 500,000 people, but close. After multivariate adjustment, habitual calcium supplementation in diabetics increased cardiovascular disease incidence, mortality, and all-cause mortality. And it may be that this is simply a marker that people who need calcium supplements are perhaps eating poorly. Remember, the best way to get calcium in your diet, of course, is to eat green leafy vegetables. But it turns out that cardiometabolic and kidney disease are all really one thing if you understand our current concepts of medicine. And this may just be a marker of poor eating. So this is another interesting study. This came out of JAMA Cardiology. And it turns out that when you look at an analysis of a decent database here, the prevalence of cardiometabolic and renal conditions, it looks like that the vast majority of the population, a quarter, had at least one cardiometabolic renal condition. 8% had 2, and at 1.5 had 3. And overall, chronic kidney disease and diabetes were tied together as the most common dyad. Another Japanese study came out here, people who had diabetes and diabetic retinopathy, which is what affects vision in diabetics. And after adjusting for potential confounders, the highest quartiles of total fat had 2.6 times the likelihood of diabetic retinopathy. Highest quartiles of saturated fat, 2.4 times the likelihood of diabetic retinopathy, which made the authors conclude that a high intake of fat and saturated fat may affect the development of diabetic retinopathy, even in individuals whose total fat intake is much lower than that of Westerners. So in general, eat better and lower fat. Interestingly, there's been lots of data over the years about male fertility and female fertility. This was an interesting one that showed that a Mediterranean diet, which was when practiced in the traditional Mediterranean way as a predominantly plant-based diet, which is different than the US take on that, which is mostly feta and lamb, which is not a real Mediterranean diet. But if you do follow a real Mediterranean diet, you had all sorts of improvements in fertility markers. And it's thought due to the high intake of antioxidants and the low intake of trans fat and saturated fats. How about in this one? This was a really interesting one. So they did a genome-wide association study to identify genetic variants associated with people who are fatter, and they combined them to generate a polygenic risk score. And what they did was they found that the plant-based diets were associated with the lowest body fat and the least propensity to develop obesity when compared to high protein or low energy intake diets. And so the authors were able to say that they could offset the effects of a high genetic risk for high body fat by modulating nutrient intake. So this is something that's saying, yes, you may have bad genes, you may have genetic predisposition to be heavy, but if you change what you eat, you might not develop that heaviness, which is pretty amazing stuff. This was an interesting one here. So participants that were in an early addiction treatment program followed a plant-based diet, and it turns out it improved their mental health outcomes, self-esteem, resilience, etc. And it was a small study, 33 individuals, and they measured the healthy eating index, which is a measure of how well people eat. This was an interesting study here out of Denver, 145 participants that are part of the Denver Urban Gardens who got a community garden plot. So they got a piece of land. And within 6 months, the new gardeners were averaging 2 to 3 visits a week, eating an average of 1.4 grams more fiber per day, and had upped their physical activity by 42 minutes per week, with stress and anxiety levels decreasing. So there really is some magic to getting out and gardening and growing your own garden. So definitely do it. Of course, I would be remiss, as I always would be, if I talked only about nutrition. Remember that lifestyle includes diet and exercise and stress relief and sleeping enough and connecting with others. And in this large prospective US cohort of 116,000 participants, they followed them for a course of 30 years. And it turns out that if you met your long-term leisure time activity guidelines, so up to about 299 minutes per week, 150 to 299 minutes, you had lower risk of mortality by a pretty large magnitude, 20 to 25%. But if you were able to achieve 2 to 4 times that, so up to 600 minutes a week, you had a whopping 38% lower cardiovascular mortality. So we as human beings were designed to move, and I highly recommend you move and move lots. And if you have the time to get in 600 minutes a week, by all means do it. But if not, get at least 150, if not 299 minutes a week. Interestingly, further along exercise, this was a really interesting study here. Brain-derived neurotrophic factors promote neuroplasticity. And if you want more of this, there's a few ways to get it. One is to fast for 20 hours. The other is to do light exercise for 90 minutes or high intensity exercise for 6 minutes, or you can combine it. And it turns out that brief, vigorous exercise was the most efficient way to increase this compared to 1 day of fasting with or without a lengthy session of light exercise. And this factor increased by 4 to 5 times more compared to fasting or prolonged activity when doing this vigorous activity. So get in some real vigorous activity every day if you can, on top of your usual 30 minutes. Another study here said followed about 500,000 participants free of dementia. And it turns out that being sedentary for 5 to 8 hours each day increased the risk of dementia by 7%. But if you're 8 hours or more, by 25%. And if you replace the sedentary time with exercise, you reduce the risk of dementia 6% less and 18% less than those who had a genetic risk factor. So this is another study showing that, yes, you may have a gene that makes you more prone to dementia, but if you exercise, you can actually sometimes defeat or diminish that genetic predisposition. Of course, the mainstream media now is starting to really get on many of these things. Wire magazine was able to show that many Amazon products that have meat or animal-based foods in them often have donkey meat in them, believe it or not. And there's a lawsuit claiming it's illegal in California. So maybe be careful what you buy on Amazon. This was another interesting study out of the Malmo Diet and Cancer Cohort study, 24,000 participants, 25 years of follow-up. And the people who followed the closest adherence to the Eat Lancet diet, which is a plant-based diet, had markedly less heart attack, about a fifth less across genders too. Many people will say to me, Doc, I'm a big weightlifter. I like to lift weights. And if I eat this way, I'm going to have no muscle. And it turns out that in this small study, they did some muscle analysis, cross-sectional area, whole body lean mass, thigh muscle volume. And young adults who followed a plant-based diet showed no significant differences in any of these measures. and a high protein vegan diet is as effective for optimal skeletal muscle development during intense trainings as non-vegan diets. Now, many of you have probably seen this erythritol, which is an artificial sweetener, which used to be thought of as safe, may not be. This was an interesting metabolomic study in people undergoing cardiac risk assessment, and they found that polyol sweetener levels in the blood, especially erythritol, was associated with increased risk of cardiovascular events. And at physiologic levels, erythritol enhanced platelet reactivity, meaning it made more likely to create blood clots, which is some of the mechanisms behind heart disease. They even did a pilot intervention study where they gave erythritol to healthy volunteers, and they found that it had plasma erythritol levels that were sustained and affect the platelets as well. And validation cohorts of this confirmed an association with an up to 20% higher risk of major adverse cardiovascular events. So again, stay away from artificial sweeteners if you can. The best drink for human beings remains water, with a close second by unsweetened coffee or tea. Osteoporosis, 10,000 adults over the age of 60 had ultrasounds of their heel bones, and those who ate a healthy plant-based diet had higher bone mineral density than those eating animal foods. And they also found a clear dose-response relationship, and when people ate healthier plant-based diets, they were most protected against osteoporosis. How about getting a bigger brain? So in 6,000 participants, those who consume magnesium-rich foods like leafy greens and nuts had larger brain volumes, and on average, higher baseline dietary magnesium intake was associated with these volumes, and the effect was particularly significant amongst premenopausal women. This was an interesting review that came out of Nutrients recently, and what it showed here is that foods such as nuts and brands, especially with prudent plant-based low diet, diet low in saturated fats, complements supplements such as phytosterols that can significantly lower LDL. And they say that a combination of such foods has been shown to lower LDL by 20%, and a nutritional approach requires backing from industry to develop and market lower cholesterol-lowering products before pharmacology replaces the diet option. And we need energetic support from health professionals. Thought that was a really nice way to close that paragraph there. TMAO. So for those of you who haven't seen me talk about transmethylamine oxide, 6,000 plus adults from the MESA study measured at baseline in year 5. And it turns out that TMAO comes from when you eat, say, an animal-based food, carnitine gets converted to TMAO, and it increases mortality, and in this case, death due to kidney failure by up to 44% more. And the take-home message is associated with mortality, especially due to cardiovascular and kidney disease. So another interesting study came out looking at various diets. They looked at a meta-analysis of 40 different trials. They looked at 7 named diets. The Mediterranean diet had prevention of all-cause mortality, cardiovascular mortality, stroke, all these things with moderate certainty evidence up to 52% less. And the other low-fat programs provided superior to minimal intervention for prevention of all-cause mortality, et cetera, based on moderate certainty evidence up to 1/3 less. And the absolute effects were even more pronounced for high-risk patients. So in general, many of these diets are sort of a theme with some mild variation around them. And in general, when you eat a predominantly low-fat, whole food, plant-based diet, you always do better. Interestingly, I subscribe to a number of the cardiovascular business journals and emails and whatever. And this was right in there one day. Plant-based diets linked to lower cholesterol levels and reduced risk of blocked arteries. So this concept is starting to really hit it in the business world. And of course, if you look, this was a study of 30 trials over the last 43 years. Compared with the omnivorous group, the plant-based diets reduced total cholesterol by about 7%, and LDL, the bad stuff, 10%, and ApoB, which is perhaps even more of a potent way of measuring risk, 14% drop, and the effect sizes were similar no matter what you did. So again, plant-based diets are pretty great to lower cholesterol. And in fact, the National Lipid Association actually endorses this approach now. A healthy dietary pattern improves dyslipidemia and other ASCVD risk factors. Combining nutrition interventions can have additive effects. Interventions for triglyceride elevation require individualization, and help with from dietitians is critical. And then, as you probably know, the United States continues to share the awful honor, if you will, of having some of the highest amounts of colorectal and digestive cancers in young people in the world. And in this large study follow-up of about 5 million person years, when people ate better, they had much less digestive system cancers, even liver cancer. And then if you look at this interesting study that also came out of the UK Biobank, participants who had better eating scores had much less death from all causes, cancer, cardiovascular disease, ischemic stroke, and heart attacks. Whereas if you had you were eating unhealthy plant-based diets, you actually increase your risk for death and cancer. So your best bet is to really stay away, if you can, from all of the processed stuff. What I always tell people is these days, when you go plant-based, there is literally an option for any food that you used to have in the non-plant-based world. And that doesn't mean it's healthy. So you really want to do your best. And as I tell my patients, that you want to eat like a peasant, simple, basic foods so that you can live like a king or a queen. And that, unfortunately, is not the highly processed, high-fat foods that are often available in plant-based worlds. This was an interesting study, again, looking at phytochemicals, so plant-based chemicals, and they found that positive associations between polyphenols were found in people who ate better, and higher intake of flavonoids showed a negative association with 10-year risks of atherosclerosis and cardiovascular events. And to get more of these flavonoids in, there's a little chart on the bottom of the screen here, but all the good things like berries and apples and almonds and even dark chocolate are a good way to get some of these in your system. Now, we know that the root cause for all disease continues to be inflammation, and one of the benefits of eating this way is that it reduces inflammation. And if you look in this particular study, which was analyzing all of the different major cholesterol trials, is that when they measured CRP, high sensitivity CRP, those with the highest levels actually did markedly worse. 168% more cardiovascular mortality, 142% more all-cause mortality based on CRP alone, which means that when we can cut inflammation, we can really target the disease. And so LDL, the bad cholesterol, is certainly a helpful tool, but nowhere near as good as inflammation as a measure. More studies have come out recently, and now all the professional societies no longer endorse drinking any amount of alcohol. In this particular study of lots of participants, almost 5 million, it said that there was a significant increased risk for drinkers who drank up to 65 grams per day of alcohol for a variety of cancers and mortality, and worse mortality amongst female drinkers compared with female lifetime non-drinkers. Now, this was a fascinating study about urinary tract infections. So E. coli, which is a big cause for UTIs found in meat, may be cause of the 500,000 plus urinary tract infections in the United States. They did a genomic analysis of this E. coli, and 8% of the E. coli were caused by bacteria strains present in and consumed through meat, interestingly enough. Another interesting study of gallstones here showed that if you had more fiber in your diet, you had 56% less likelihood of developing gallstones. There's really no medicine that can cut that risk. And the effect was strongest in older and overweight or obese people. Again, as I mentioned before about sugar-sweetened beverages, there was an 8% increase in all-cause mortality for each additional sugar-sweetened beverage consumed. Whereas when you replace one of these drinks a day with coffee, you actually dropped your mortality, and the same for tea or water. So again, sugar-sweetened beverages are harmful, and artificially sweetened beverages are also harmful. So again, water, tea, or coffee unsweetened is the way to go. And then you may have seen this, but they finally, the WHO, after years of lots of sort of muttering about this, they finally said that aspartame, which is known as Sweet and Low, for those of you who know the brand name, is now officially a possible carcinogen. It's been off the list for a variety of political reasons over the many years that it's been out. Now, many of you who are plant-based eaters will enjoy French fries sometimes too often. And it turns out that 140,000 people that were followed, that there was a significant risk of anxiety and depression when you ate more frequent fried foods. The thought is it's related to acrylamide, which in certain states in the United States is considered to be a carcinogen, like California. So in general, do your best to not fry your potatoes if you can avoid them. And then this was an interesting large meta-analysis here of 5 million people again, and red meat consumption was looked against cardiovascular disease. And the more you ate, the more cardiovascular disease. So 11% more per 100 grams per day and 26% more for processed red meat per 50 gram per increments. So very, very easy to get harmed by what you eat. This was a really interesting study out of Korea, 6,000 adults. They looked at people who were following a Mediterranean diet, again, a predominantly plant-based diet. And women with the highest adherence to this diet had a 71% reduced odds of depression, and men 79% reduced odds. So what we eat may actually help us to stay happy. This was an interesting one for ALS, or commonly known as Lou Gehrig's disease. This was higher ALA levels, which come from things like ground flaxseed, et cetera. Also led to less death, and also a variety of cognitive diseases. And so in this particular study, when they looked, for every one standard deviation increase in ALA, which you could find again from flax seeds, you had slower functional decline. So many people know that I work at National Jewish Health, which is a respiratory hospital, and people are often surprised to learn that what you eat may affect your respiratory system. And in this particular study, they looked at some of the mechanics that we measure of people's lungs. And it turns out that those who ate the poorest actually had the greatest declines in their lung capacities. But when you ate a plant-based diet, you had slower lung function decline, which was pretty eye-opening to many of my colleagues. As I mentioned before about colorectal cancer, this was interesting. So this one looked at when you were overweight or obese and what it led to later in life. And if you were overweight in early adulthood, you had 23% more colorectal cancer. If you were overweight in middle adulthood, 23% more colorectal cancer. Later adulthood, 21% more colorectal cancer. But if you were obese in middle adulthood, it's 55% more colorectal cancer, and obese body mass index in later adulthood, 39% more colorectal cancer risk. So it's really never too late to make these changes to get thinner and fitter if you can. This was an interesting study of 61,000 Chinese folks that living in Singapore, followed for 20 years, and they had 27% more colorectal cancer risk when comparing their low carb, most animal-based, higher fat diets to the least. And so, interestingly, if you do decide to be a lower carb type of person, maybe consider doing it in a plant-based way. And it turns out that a low carb plant-based diet reduced all-cause mortality by 13%, with each 5-point increase in plant-based low carb diet score reducing mortality by 4%. Animal-based low carb diets increased risk by up to 16% from cancer in particular. And then the plant-based low carb diet did not impact cancer risk at all. This was an interesting one here, 20 randomized controlled trials involving nearly 1,900 participants, and they were including some of the highest risk patients. And they found that when people followed a vegetarian or a vegan diet, they actually lowered their LDL, their blood sugar, their body weight, more than just following sort of standard therapy. And so the dietary impacts were felt to be better than just standard therapy. This was an interesting one about sleep. So it turns out that when you eat a high saturated fat diet, it may lead to daytime sleepiness. This is a small study of 14 patients, 21 days on a whole food plant-based diet. And it turns out they were much less sleepy when they changed their diets. I've mentioned this before, but osteoarthritis is an inflammatory condition, which is super common. It turns out that if you study these folks, they did a plants for joints randomized controlled trial. And at 16 weeks, the intervention group had a significant improvement in their WOMAC score, which is a way of measuring arthritis. They also lost weight and fat and circumference and all the good things they normally would. And then you may have seen some of these things in the mass media out there, the New York Times here. So been lots of studies in the last several weeks, and then most recently in the last couple of years between highly processed foods and brain health. And it says here, eating packaged foods like cereal and frozen meals increases anxiety, depression, and cognitive decline. There was one study, however, that did show that alcohol could have a benefit. In this particular study, it was a randomized crossover controlled trial involving 42 men with documented coronary disease. And it turns out that they had a little bit of alcohol and then a washout period with no alcohol. And it does improve some of the gut bacteria. So there may be a tiny positive if you're looking for one. And then this was an interesting one. So more and more of the health journals out there are starting to discuss environmental health and how it impacts human health. And the thought is that by mid-century, there'll be up to 3 times the number of extreme heat days. And each of these increases the deaths amongst elderly and even non-elderly adults. And the effect could be 5 times the number of cardiovascular deaths just by environmental changes alone. And if you look at all the various studies that are out there, but this one was very interesting, 55,000 vegans versus the usual mix of folks. And it turns out that when you compare it to a meat-based diet, a vegan diet results in only 25% of the greenhouse gas emissions, 25% of the land use, 46% of the water use, and 34% of the biodiversity loss compared to a meat-based diet. And the authors concluded that despite substantial variation due to where and how the food is produced, the relationship between environmental impact and animal-based food consumption is clear and should prompt its reduction, interestingly enough. This was an interesting one here, looking at life cycle assessment, which is a way to evaluate the environmental footprint of a product. And a vegan diet had a 44% less total environmental impact, even when compared to a Mediterranean diet. So the authors concluded that a minimal to moderate content of animal foods has a consistent impact on the environmental footprint of a diet, and their reduction can elicit significant ecologic benefits. Now, I was very surprised when I saw this, but I couldn't believe it. But Hershey's came out with plant-based versions of their products to appeal to the markets. Pretty amazing to see that there is enough demand for this. Again, not a health food, but certainly shows you where trends are moving. And you may have seen this, but in Europe, animal meat and milk sales dropped markedly as plant-based versions are emerging as big sellers. And then interesting, this was a really unique study which looked at the costs of a variety of diets. And they looked at baseline DASH, which is the dietary approaches to stopping hypertension, and a whole food plant-based diet. And it turns out that the whole food plant-based diet was the cheapest. And even when adjusted to an 1,800 kilocalorie per day intake, still the cheapest, even compared to DASH, which is a predominantly plant-based diet. And when you look at the ingredients alone, a whole food plant-based diet, of course, remains cheaper, although many of us are still charged more. And so maybe it's time to make the pharmacy, with an F, dispense. And so this interesting study did just that. They had 22 produce prescription locations in 12 US states. 4,000 individuals were followed. And it turns out that at 6 months, produce intake increased, food insecurity dropped, one level in self-reported health status increased, and even 2.5 times better for children. Hemoglobin A1C, a measure of diabetes, dropped, blood pressure dropped, and body mass index dropped, all from prescription produce. Pretty amazing stuff. And in this interesting study of 500,000 Chinese, 2/3 of diet-related cardiovascular deaths can be attributed to low intakes of whole grains, fruits, vegetables, and nuts. And so the rates are only increasing. Of course, I've spoken before about mindfulness. This was an interesting study of yoga. And what it looked at is people who had heart failure or who underwent coronary intervention, revascularization. And they took 35% participants and put them in their interventional group, 40 in the non-interventional group. And the interventional group received yoga and guideline-directed medical therapy, whereas the non-intervention group just got the guideline-directed medical therapy. And they actually measured some parameters by echocardiogram, the ultrasounds of the heart, and it showed significant improvement. And in fact, functional classes also improved with the yoga group. So in general, yoga seems to have a very powerful way of improving outcomes. And then if you want to remember just 5 things to keep in check, in this particular study here, body mass index, blood pressure on the top, the systolic, non-high density lipoprotein cholesterol, smoking, and diabetes, if you could get all 5 of those, the population attributable risk was nearly 60% for women and 60% for men. So they are estimating that roughly 1/5 of deaths among women and men may be attributable to these 5 modifiable risk factors. Pretty amazing. And then for those of you that are still eating fish, it turns out that maybe some fish are actually a lot more sentient than we thought. This was an interesting study that showed that some fish might be self-aware and recognize themselves. And it turns out that when there's people like me and Kim Williams and a bunch of others around, we are able to insert important things into our guideline documents. So this is one that just came out about heart failure with reduced ejection fraction. And we actually were able to get this statement in: poor nutrition may result in worse heart failure outcomes. And in line with our prevention guidelines, a low-salt, plant-forward diet has robust evidence to aid in the management of heart failure, including their common morbidities. I thought that was a pretty powerful statement in the main guidelines. And then, of course, I would be remiss to not show you how powerful this is when we did the Ornish Intensive Cardiac Rehab. You can see that when people are sick to get in, which is after they've had a heart attack or a stent or bypass, when we enroll them in this program, which is 9 weeks long, and we teach them how to live and exercise and eat and de-stress, everything improves, including their cholesterol and weight and blood pressure and their depression scores and their exercise capacity. It's pretty darn amazing. So, in sum, what is success? It is a low-fat, 100% whole grain, minimally processed, whole food, plant-based diet. Whoops. And nothing will benefit human health or increase our chances of survival for life on Earth as much as the evolution to a vegetarian diet, said Albert Einstein. I encourage you to check out some of our initiatives to get people moving, like Walk with a Doc, which is a national program. You can find that online very easily. We also have a Zoom-based transitioning to plant-based support group so that you can find peers and colleagues willing to make these changes. And if you're not convinced, do your own research, read about it, learn about it, and you will be blown away with what you learn. And with that, I left a few minutes for questions. So I'm going to see what Chef AJ has come up with.
Okay, so I have 5 questions that were sent in advance, and I'm sure there's stuff in the chat. But I appreciate you talking about erythritol and aspartame, because people still think they're benign, and but more importantly, they think they actually help with weight loss, and I don't see the evidence where it does.
No, in fact, many of the artificial sweeteners trigger an insulin response, which will actually make people gain weight. So, many of us have seen very large people consuming diet sodas, and you often wonder if there might be a connection. There very well might be.
Yeah. So like, for example, I find that, like, I don't know how you plow through this, because I find the research so confusing, because even you said, like, in that article about red wine may be helpful. How can any person that's not a doctor even make a decision? For example, one of the comments on Instagram or questions is that I avoid all oil, but recently read a research paper showing amazing benefits of flaxseed oil. So how can anyone make an informed decision?
Yeah. So first, research in nutrition in particular, in my opinion, is a constantly evolving specialty, and the science changes. And as we learn more, sometimes what we once thought was healthy, we find is not so healthy. And so it's important to stay on top of that. And your physicians should also do the same to help work with you. But I would say that in general, we look for the signals and the noise. So if you look, alcohol for a long time has been shown to potentially reduce the cardiovascular event rate when consumed in very small quantities. But it turns out that the risks of breast cancer and addiction and a number of other things outweigh those benefits. So in general, most of us from a population whole level would tell people to not start drinking. And if you are drinking, to drink very little. And so I think that's the best way to synthesize that particular data. There's always going to be, a plus or a minus to everything. And the goal is to try to put together the data so that there is a clear overall direction, even when there may be some noise that's mixed in.
So, you said nutrition changes, but does it really? Because Dr. McDougall always says the truth never changes.
That's absolutely true. So the nutrition itself and the truth doesn't change, but what we discover as the truth may change. Remember, it's not like somebody whispered in my ear and said, I am the all-powerful creator, and this is what you should do. But it turns out, if you go back in time, if you look at whatever religion you might follow, right, whether it's the Daniel diet or the diet Noah consumed or whatever it may be, there's lots of hints throughout time that people that are plant-based were doing better and even sometimes miraculous things. Now, just because you eat plant-based doesn't mean you're going to live 600 or 900 years like Noah did, but it certainly is an interesting concept to think about. So at the end of the day, I guess what I would say is, yes, human beings haven't changed very fundamentally, and the nutrition we were supposed to eat probably hasn't changed very fundamentally, but what we offer each other has changed very fundamentally over the last 50 to 100 years. And it's a really fascinating evolution. I encourage people to look up the history of this. If you go back in time in the early part of when it was of the 1900s, many people in the United States were actually underweight. And when the US military was trying to recruit people, many people were rejected because they were considered frail. And so there was a great rush to figure out a way to get calories into people's hands. And this was the emergence of the ultra processed foods. And unfortunately, that movement has stayed because ultra processed foods have a variety of things we find so very desirable. They have amazing textures, they're high fat, they're high sugar, they're high salt. And so everybody wants lots of them, and it's easy to overdose on the calories. So bottom line is, I guess at the end of the day, I think that your comment is true. Fundamental human nutrition has likely not changed, but the evidence we've been able to develop and collect on it is changing. And what's funny that people always tell me, oh, Dr. Freeman, you're so innovative. And here I am giving out peas and carrots instead of the latest pills. And I always tell people, this is the same advice that Hippocrates gave us or Maimonides gave us, depending on whatever part of the world you follow. So.
Nice. Thank you. We've got some interesting questions. This one is from Marilyn. And she says, I've been eating mostly plant exclusive, but there's days I cave and eat something that's high in fat and sugar and highly processed, like a Costco cake or something from the bakery. How long does a fatty, sugary food stay in your body? And how long does your blood and cholesterol levels stay elevated? And how long does it take to eliminate the body and be back to a normal, healthy level? And how much of a setback can this cause to one's health efforts?
Yeah, that's a pretty loaded topic. So first, your blood sugar will tend to spike, and then depending on what you eat, it may stay sustained high or not. And every person's a bit different. So if you're curious about that, you might want to talk, and you can even get over the counter now a continuous glucose monitor and see what the response is. And interestingly, some people can eat a cake and their blood sugar doesn't spike, and most people's do, but some don't. But in terms of, there's been lots of studies over the years that show that when we consume a high-fat meal, we have a transient effect on our blood vessels, the endothelial cells, where they effectively shut down for several hours in most cases. So bottom line is, I always tell people, whether you eat a pinch of cyanide or a pound of cyanide, it's likely to kill you. So do your best to limit all of them if you can. And you can often find a cake that's made with healthier items that doesn't necessarily have to have oil or butter or eggs or milk or cream or whatever in it that still will satiate you. And I'm sure that Chef AJ can give you some of her favorite dessert recipes, and you will be just as happy as if you had that Costco cake.
Of course, I can't find my book right now because I have one coming out that just fits that bill. Where the heck is it? It's called Treat Indulgence, and it's all, SOS free, vegan, and even low calorie density desserts. Thanks for the plug. I only had my book with me at this moment.
Yeah, yes, and I didn't even intend for that, but I am glad to tell you that she has some amazingly tasty recipes. And as much as you might think that you need to have a cake from Costco, you probably don't. And the truth is, the vast majority of mass marketed cakes are really not good for you. So do your best to stay away from them.
Absolutely. Hydrogenated oil, for example, not just the sugar and flour. Yep.
Yes. Yes.
Thank you.
Yeah. Human beings were not intended to eat neon pink icing that's shelf stable for 3 years.
That's so funny. There was this doctor in LA that he used to take things like Twinkies and McDonald's cheeseburger, and I mean they never decompose. Like 6 years later, they looked exactly like they did when you bought them.
Yep.
This is from Victoria, and she said, last month I asked my cardiologist to reduce my statin drug in half to 20 milligrams because he would not take me off it completely, even though in March my blood work showed cholesterol 133, triglycerides 89, HDL 47, LDL 68, and hemoglobin A1C 5.5. I do not like taking it. He did lower the dosage, not in agreement, and scheduled me to return in July to check blood work. At 77, I continue to live in a plant-filled world with beans, grains, nuts, and seeds without oil, sugar, and very little salt. I don't want my levels to have increased, proving him right, because I truly believe my numbers look good from the food I eat. Is there anything more specific you'd suggest?
So this is a loaded topic, and let me explain to you that the purpose of a statin is not to lower your cholesterol. And I know that may be shocking to most people, but really what we're trying to do is lower your risk of a cardiovascular event. So as Kim Williams says, as we get older, we're all more likely to die, and most of us from heart disease. And so the question is, what can you do to reduce that likelihood? And that's where a statin may come in. And there's never been a really good randomized controlled trial with outcomes of a statin versus a plant-based lifestyle. So what I tell my patients is a low-fat, whole food, plant-based diet is most likely to reduce your cardiovascular risk. And so is a statin in the right situation in an individual. And many times they're synergistic. So in general, yes, you can probably get your cholesterol below certain goals, but it turns out that the statin in particular lowers one's cardiovascular risk. And if your risk is elevated, which for many people over their mid 70s is usually the case, or if you've had a prior event like a heart attack, stroke, stent, bypass, whatever, it may make sense to be on both. And we know that the high intensity statins, which are usually defined as atorvastatin 40 to 80 or Crestor 20 to 40, which is rosuvastatin, that may be the right thing to do. And so you want to make sure that you have an individualized discussion with a knowledgeable cardiologist that knows prevention. If they haven't said this type of conversation with you, it might be worthwhile to seek another opinion.
Thank you. This is from Randy, and she says her husband has heart disease with 70% occlusion in the widowmaker. 2 years ago, when he found out, he completely changed his diet to whole food, plant-based, no oil. He lost 30 pounds and is skinny now, bikes 6 times a week and feels great. And we turned down the statins, but would like to know if nuts and seeds are an acceptable part of his diet. There's confusing information out there about this.
Yeah, so again, I'm not entirely sure on this individual case, and I would defer you to your local expertise and listen to your cardiologist. But if there is a 70% left main lesion, there's only two places in the coronary tree that are prognostically important that we intervene on. One is in the left main, the other is in the proximal LAD. And if those vessels are indeed as tight as described, then 70% would be sort of at the threshold of when we might intervene. An intervention may improve outcomes and longevity, whereas the rest of the coronary tree may only improve symptoms. So just food for thought there. So that said, in the plant-based world, there's a lot of controversy around how much oil, any oil, nuts, seeds, etc. And even if you press Esselstyn hard enough, he'll tell you, yeah, you can have 3 walnut halves in a day, which of course is like the smallest amount ever. I guess what I would tell you is if you look at the studies that have been done, certain oils and certain nuts and seeds in moderate to small quantities may have some benefits. But for many of my patients who are high risk, I usually recommend that they cut it down to as little or zero if possible. And the only reason for that is that there is some evidence that suggests that high-fat diets, as I mentioned before, can significantly impact endothelial cell function. So everybody has an individualized approach. And if you said to me, is there some amount of nut that I can consume that probably won't hurt me, that may have benefit? There probably is, but it's probably very small. And remember, if you look at walnuts, for instance, or you look at chestnuts or whatever, they all come in these intense shells that take a long time to open. And that is designed to slow us down, right? So that's the goal, is to eat as few of those as you can. But they are tasty. Now, if you said to me, I'd rather have, a handful of pistachios versus a bag of M&Ms, I would wholeheartedly agree. But if you said to me, could I have a few pistachios and be satisfied? That's probably where I would go. But again, I think everyone's situation needs to be weighed carefully. There have not been a lot of great research papers on people who have advanced coronary disease and nut intake. But I would tell you that the overwhelming evidence on nuts does appear to be positive, but again, not in huge quantities. So,
well, who are those people that can have 3 walnut halves? And by the way, you know what this is?
it might be is it a chestnut or a walnut? I can't know.
This is a walnut, and this
Walnut.
is after that huge amount of dirt, so this isn't even how it appears in nature. And inside you have that. I mean, who could even open these?
It's I mean, again, with the right tools, anything's possible. But regardless, I guess what I would say is I'm not sure who the right people are, and that's where there's a lot of debate. That said, if you said to me, look, I eat, a bag of walnuts in an entire year, I'm probably not going to be too problematic with that. But some people would certainly say no nuts at all. And again, you have to weigh what your risk tolerance is, because a lot of times when we change our diet, it's really a hedge. It's a bet against our genes. We don't always know what that means. Meaning, I know people that are 100+ years old that smoke a carton of cigarettes a day and basically drink out of a fryer. But you don't know you're that person until you get there. And that's the hard part.
Exactly. Nancy would like to know if the procedure that a dermatologist does to inject spider veins to make them disappear is safe for one's cardiovascular system.
So I'm not a dermatologist, with full disclosure, so I certainly am not expert there. But in general, they usually inject something that makes that spider angioma or whatever it is disappear. I don't think that has a major effect on your cardiovascular system. But again, I haven't spent enough time really looking into that particular topic. I'm sure there are some case reports somewhere where somebody had one of these things injected and they missed or something and something bad happened. But by and large, I don't know of any, it's not something in common parlance that I would tell people.
Right. Good to know. Peggy would like to know what causes high triglycerides. She eats whole food plant-based. And is that a worry? Is it a risk for like developing some kind of cardiac event if you have high triglycerides?
Yeah, so high triglycerides are blood fats. So if you have very high triglycerides and I was to draw blood on you and spin it out, there'd be a layer of cream at the top. And they come from white carbs, sweets, sugars, candies, and alcohol. And your best bet is to try to limit those as best you can. That said, vegans do tend to run higher on triglycerides. And as long as they're not very high, you're probably okay. But if you are very high, it might mean a major change. So for instance, I've taken care of a couple of people who moved from Japan here to Colorado, and they were eating white rice, 3 or 4 times a day at various meals. Their triglycerides were very high, meaning like 5, 6, 7, 800. And I forced them to change to brown rice over their desire, so that they thought it was, not the right food for them. But when they did that, their triglycerides plummeted. So some people are very sensitive and make triglycerides. Some people are not. But if you are high, consider eliminating some of those foods I mentioned.
Thank you. If you have time for one more question, just tell me
Yeah.
when to stop talking. This is from Morgan, and Morgan says, I'm a 46-year-old female. I switched to whole food plant-based SOS-free diet over 5 years ago and successfully brought down my total cholesterol from 264 to 170, my LDL from 190 to 117. I was recently rechecked and my total cholesterol is back up to 225 and my LDL is up to 156 again. I have let some small amounts of processed vegan junk food back, and I'm redoubling down on my whole food plant-based SOS-free routes that brought my numbers down originally. What has changed is that I'm entering menopause. Could the shift from perimenopause to menopause has caused the shift? Is diet enough to bring my cholesterol numbers back in the safe range? I always want to know what a little bit of junk food is. You know what I mean?
Yeah, and the truth is, I mean, everybody has a variable course. So menopause can certainly affect cholesterol, your hormones, your thyroid, whether you eat high fats and junk food. I mean, there's so many factors here. And there are some people, I take care of a lot of people actually, who are very low fat, whole food plant-based eaters. And no matter what they can do, their LDL never quite gets below 120. So there are some genetic things. Remember that cholesterol was not something commonly found in the diet, nor were fat, sugars, and sweets. And so there are some people who are very avid for them and hold on to them. So I don't think there's always an easy answer there. But I guess what I would tell you is keep putting your efforts in, focus on getting your overall numbers down and your overall health improved. But even things like sleep and stress can affect your cholesterol. So make sure that all of those tenets, right? Eating plants, exercising more, stressing less, sleeping enough, and loving more are all in check, because they all have an effect on your health.
Thanks. There's two more questions. If you have to go, go. Otherwise, I'll ask
Yep,
as
I have a couple minutes max here, and then I
Okay,
got to
so
jump to the next one.
maybe you can answer them quickly.
Yeah.
This is from Susan. What is an acceptable level of total cholesterol for those who are on a whole food plant exclusive diet and wanting to avoid statins?
Yeah. So again, there's no absolute number that I give, and total cholesterol is not so much what I focus on, because total cholesterol is an additive of all the other things. So in general, I usually recommend that people try to, if they have no health issues, that maybe keep their LDL closer to 130. That's the LDL, not total. And if they do have health issues or coronary disease, I try to get that LDL down below 55. But again, the primary goal is risk reduction, and then the numbers are a secondary goal. So there's not an absolute number, and it's a very individualized discussion that you need to have with your physician.
Okay, the last questions, it's about the lipoprotein little a, because a lot of people are saying they have it. Is there anything specific I can eat or avoid eating to lower it? Maybe you can just say what that is and why
Yeah.
it's
So
significant.
lipoprotein A, or LP little a, as it's commonly known, 1 in 5 people worldwide has this. It's associated with markedly increased cardiovascular risk. It's estimated that every particle of lipoprotein A is 5 times more atherogenic than LDL, the bad cholesterol. Many of you know the story of the Biggest Loser TV show. There was a guy, Bob, the trainer, in his 40s, had a massive heart attack and almost died. He had very high lipoprotein A. The reason why all this matters is, for the first time in history, there'll be a drug coming out at the end of this year, beginning of next year, that actually targets LP little a and may even obliterate it, which is pretty amazing. That said, it is 90% genetic. So a lot of what you do in your life doesn't necessarily affect this. So I do recommend that everybody get it checked at least once. If you do have it, that's elevated, your entire family should be checked by, bloodline family. And there's not a lot that you can do. There are potentially some foods out there that have been mentioned that might lower it a little bit, and even statins may raise it a little bit. What most of us are doing right now is putting people on statins, and which may raise the lipoprotein A, and also a baby aspirin. It's thought that one of the domains of lipoprotein A looks like a blood clotting factor, which may contribute to the part of its effect in increasing heart disease events. And so aspirin may counter that. So that's what we're doing right now. There's lots of other things you can do. Some people take a PCSK9 inhibitor, an injectable like Repatha. And then there's drugs coming, as I mentioned, which are very exciting. So it's an exciting time to be in cardiovascular prevention, because not only is lifestyle emerging as a key player, but there are many drugs that can help with some of the genetic things we couldn't normally do anything about. So.
Right. Well, it's so great catching up to you. Come back anytime, especially if you can talk about AFib. We get so many questions about AFib. It's like crazy.
Yeah. Well, AFib is epidemic. It's worth definitely knowing that diet affects AFib. But with that, it's always a pleasure. I think I covered a whirlwind of information. So hopefully people got something out of this.
I'm,
And I look forward to seeing many of you at some of the live conferences this summer.
and can you see people virtually?
I cannot see the people directly virtually unless you live in Colorado where I'm licensed. But there are some other opportunities. There is this platform called Best in Class MD, where we give sort of second opinions without medical advice per se. So check me out on there. And other than that, thanks again for having me as always.
Thank you so much, Dr. Freeman, and thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow at 11 a.m. Pacific time for Chad Bonfiglio from Datar Cancer Genetics, where he's going to show you how with a simple blood test you can diagnose